Well, my friends, this is a new video for a case of calcaneal spur of a gentleman aged about 53 years, has come from Dhanbad of Jharkhand. I have seen the calcaneal spur cases in my life at several times, at several occasions, in several patients. But surprisingly enough, I have never seen such a worst case in my life. Even seen in the Googles, the calcaneal spur, the white portions, there are many pictures. See, this is calcaneal spur. Now, what is calcaneal spur? The calcaneal spur in a running word, it has been said that the calcaneal bone is increased. But truly speaking, it is a bony projection forwards from under surface of the calcaneal tuberosity, but the pathology is, it is nothing but the ossification of the plantar fascia. Ossification of the plantar fascia, the person, the physicians who know well about the anatomy of the plantar surface of sole, that it is a fascia known as plantar fascia, a very hard and thick fascia. This fascia becomes more thickened and more hardened and become ossified at its calcaneal end, over the calcaneal tuberosity. This is called calcaneal spur. So naturally it becomes painful when the person walks. It gives when it is in contact with the floor, in contact with the earth. But I have never seen such a bad calcaneal spur in my life. So see, this is like a deer's horn. It is like deer's horn, so bad and so rough and so violent and so surprising. However, we have treatment, we have enough scope. Now, what will be our prescription? What is my choice of medicine? See, calcaneal spur is not separately given in any repertory, except there are therapeutic books where calcaneal spur is given and some of the medicines given against the symptom. But in Kent's repertory or other repertories, there is no separate rubric as calcaneal spur. You have to see the exostosis at generators. However, the main medicines are calcarea floor, fluoric acid, silicea, nitric acid, etc. But there is no calcarea carb. But my prescription for my patient is calcarea carb, because I know the philosophy of homeopathy. I must follow the basic rules of homeopathy, treat the patient, not the disease. And considering this dictum, considering this philosophy, considering this principle, this law, I am bound enough to prescribe the symptomatic medicine. So my medicine is Calcaneal carb because the patient is cheating. Abundant sweats over the head, desire for sweets, profuse thirst, and the physical makeup, fatty and flabby. So physical makeup, fatty and flabby, profuse perspiration over the head, desire for egg, chilly patient, and constipated, sometimes passes stool irregularly. So my prescription is Calcaneal carbonica, or the middle layer of the oyster cell, in 50 millisimal scale of potencies. I do like to prescribe from potency 1, I mean globule 1, I mean millisimal 1 to up to 8, twice in a day. Let's see the result. Please remember this video number. I shall give you the result after 3 months. I am serving 3 months medicine for this gentleman and absolutely following the homeopathic law and principle, not based on the therapeutic way or nosological way. According to law of homeopathy, I have prescribed my patient's medicine, not the disease's medicine. Let's see the result. If Calcaneal carb will improve this patient, again all milestone will fall upon the homeopathic shoulder that treat the patient, not the disease theory is 100% correct. And also homeopathy has the scientificity, it has the power, it has the ability to cure patients, even the structural changes. Because this is nothing but the structural change, it is not a functional one. Definitely it has been seen that the calcaneal spur is so large, big, thick, and abundant and fearful situation. The patient is in distress for walking. So let the result I shall share you, my friends. Once again, may I repeat you that please take the case carefully, judiciously, sincerely, rationally, with attention in observing, with freedom from mind, any prejudice, and after that, analyze the symptoms, evaluate the symptoms, interpret the symptoms, and finally find out a medicine. Among the similars, only one similimum. This is the only guide, this is the only rule, this is the only basic principle of homeopathy. Never forget this. If you deviate from this rule, you will destroy everything in your life, and the homeopathy will be forbidden like Western countries in this subcontinent. Thank you very much for your kind cooperation.